Good afternoon, Doki.
Good afternoon, Kunle. How are you? You look worried. Hope Titi and the baby are fine.
Doki. They are fine, no? And I just wonder why life is so wicked. Leo.
Kunle. I feel a gist coming on. Who has life been wicked to?
See, Doki. I know say you no go believe me. But you see, you get some matter wey no be ordinary eye. Una Doki sef no. And una dey talk am sometimes. When Doki don dey tell person say, sorry, nothing dey wey we fit do about am. Na ordinary eye be that one.
Brother Kunle, what exactly are we talking about? Anyway, the truth is that doctors are not God. And sometimes there are situations beyond our control. Especially when a patient is brought to us very late. By time which the disease process has gone so far that there is very little we can do to salvage the situation.
Doki, small pikin dey get cancer.
Okay, we're getting somewhere now. Yes, it's true that children can have cancer. There are different possible types of cancers that children can have. But the good news is that with most childhood cancers, if identified and treatment commenced on time, many are treatable and some even curable. But where is all this cancer talk coming from?
See, Doki, you get one 5-year-old boy for our street where I hear say don dey sick small. By the time dem carry am go hospital, dem talk say na one kind cancer e get. And I hear now say the parents don carry the pikin go village when doctors tell dem say nothing dey wey dem fit do again. The gist wey I don dey hear small now be say e be like say the pikin don die for village.
Wow, that's pretty sad. Well, I can't tell what kind of cancer the child might have had and why it wasn't treatable. I can say though that noting quickly when things are amiss and going to the right kind of hospitals, I mean registered public and private hospitals where the healthcare professionals there know their onions, can be critical to making a quick diagnosis and treatment. And receiving the right kind of treatment can be critical to the survival of those children, especially meaningful survival without any complications. People often spend so much time self-medicating and experimenting without presenting to the hospital until things get out of hand.
Doki, tell me more about this cancer dem, abeg.
That's a tough one. Where do I start? Anyway, I can talk about some of the common cancers that occur in children, the signs to look out for, and possible preventive measures.
Okay, Doki, I dey follow.
Perhaps the most common childhood cancer that we come across are blood cancers, such as leukemias. For most cases, there are no known causes for these cancers, but in some cases, it is due to some genes that run in the family, and for some other cases, it could be due to exposure to cancer-causing agents such as radiation.
Doki, make I go pack my microwave. They talk say they cause radiation.
No, Kunle. Firstly, the kind of radiation that is applied in microwaves is not the kind that causes cancer. And even for ionizing radiation that can result in cancer, there is an amount of exposure that one has to have. And for most people, they never get up to this level of exposure. Those who are at greater risks are those who are involved in carrying out investigations such as X-rays, which is the reason why you would often see them hide behind a specialized kind of screen to reduce how much radiation they are exposed to on a daily basis while they carry out this kind of investigations for people. And in addition, these people who carry out these investigations usually have a device on them that measures how much radiation they are exposed to ensure that they don't go beyond safe limits.
Okay, Doki, I trust you. I go to use my microwave they go.
So with these blood cancers, the common symptoms that may be observed are that the child looks unusually pale, may get tired easily, doesn't have a great appetite for food, and also they can have recurrent fever, that is high body temperature. The problem here is that most people would assume it is malaria and maybe typhoid and then start loading the child with anti-malarial, antibiotics and blood tonic such that things get so bad before they eventually present to the hospital. That way, valuable time is lost, and by the time they arrive at the hospital, the disease might be pretty advanced.
Doki. Now wow, no be every fever be malaria.
I can't say it enough, Kunle. There are several things besides malaria that can cause fever, and cancer is one of them. I often say fever is smoke, and often when there is a smoke, there's fire. So just giving paracetamol and then maybe jumping to antimalarials and antibiotics when a child has a fever is just trying to blow the smoke away without identifying the actual problem. It's important when the child has a fever to give the first steps. Tepid sponge, give paracetamol, but beyond a day, you should take that child to the hospital to get checked out so that the right diagnosis can be made and the child can be correctly treated.
Doki, na serious matter be that o. To dey go hospital every time wey pikin dey run temperature.
Well, that's part of the reason why I always talk about getting health insurance. Anyway, the blood tonic thing is a big deal as well, because not knowing the reason why the child's blood level is low and how low it is just doesn't cut it. And your so-called blood tonic will take up to weeks to achieve substantial results in a person whose body mechanisms are functioning normally. Blood tonic won't achieve much if your body has a problem producing new blood cells or is having those blood cells rapidly destroyed, which is often the case in cancers.
Okay, Doki, I hear you. They talk the cancer matter go.
Other things parents can notice are unusual growths in different parts of the body. You remember those lymph nodes I used to talk to you about, right?
Yes, now, Doki, I remember. Those things where you talk say be like police checkpoints for different parts of our body where they signal if infection or any abnormal thing dey around the area, abi?
On point, Kunle. You should be getting a honorary doctor's degree very soon with how well you listen.
Baba, how humble o. To be Doki like you na work. The kind book wey na dey read, he pass me.
Anyway, Kunle, the lymph nodes beneath the chin, the neck, and other areas can become enlarged, signaling that there are cancer cells around the area. And this happens with blood cancers and could also happen with the type we refer to as lymphomas. I've seen a number of cases where these abnormal growths, whether lymph nodes or growths in any other part of the body such as the abdomen, are allowed to grow on and on while the parents experiment with agbo and all sorts of other medications till it becomes alarming. Then they present to the hospital. Not every small swelling is a boil. So when parents notice any abnormal growth on their children's bodies, they should present quickly to the hospital to have it checked out, because missing this cue might lead to a late presentation.
Doki na wow. To be parents na work o. To dey chook eye for every small matter.
Yes, Kunle. While parents mustn't get hysterical, being cautious and observant is very key. So other things that can be noticed is that the child just continues to lose weight. The clothes just seem to be getting bigger. And sometimes the child is eating well, but rather than gain weight, the child just keeps losing weight. Also, a child that sweats so much that the clothes get soaked might not just be a normally sweaty child, and it might not have anything to do with the fact that the weather is hot. It may need to be looked at.
Doki, ile gidi gan o. So na simple things like this person fit notice to catch cancer early. Na to dey shine eye well o.
Yes, Kunle, the loss of children to cancers can be reduced to the barest minimum with early detection and the right kind of treatment. Similar to cancers in adults too, though cancers in children often are more responsive to treatment than those in adults.
But Doki, all these drugs wey dem dey take treat cancer nko, I hear say the sickness wey the drugs dey cause sef dey pass the cancer sef.
Kunle, you're always hearing things. Yes, it's true that cancer drugs can have tough side effects, but there are measures put in place to minimize these side effects. And you see here, the real issue here is the benefit outweighs the risk. The cancer itself can kill, so dealing with the side effects of the cancer drugs are not as much of an issue as the damage that the cancer itself can cause. I've seen children cured of cancer, whether they were treated with chemotherapy, radiotherapy, surgery, or other means, and they're doing absolutely fine. Really, dealing with these cancers is possible with early detection and treatment.
But Doki, health insurance dey cover cancer?
Well, Kunle, while some health insurance packages may not cover the treatment of cancer itself, the process that leads to the diagnosis is often covered by the health insurance packages. An initial life-saving treatment could be given before we get to the point of the core treatment for the cancers itself. And while we sorely need well-meaning members of the society to support in the treatment of cancers, especially in children, there are individuals and organizations out there that are doing a lot to support cancer research, diagnosis, and treatment. The truth is, nobody prays to experience any form of cancers, but catch them early and there is a good chance at survival.
Okay, Doki, I don learn plenty new things again today. You too try. Make I come dey go.
Glad to always be at your service, Mr. Kunle Olofofo, the investigative journalist extraordinaire. Olori Owo Titilayo. See you later.
We go to see you later, Doki.
Hello, people. Hope you enjoyed the just concluded Kunle Olofofo series. There is a rise in the incidence of cancers, especially in children. Well, it could be a rise in detection, diagnosis of these conditions rather than their existence. But whatever the case is, we see children present to the hospital with different forms of cancers. And the problem that exists with cancers, whether in children or in adults in our part of the world, is late presentation. People tend to do a lot of experimenting at home before they come to the hospital. And then they end up in the hospital and they expect the doctors to perform some magic. It's often a very sad story, seeing children with advanced cancers, and you wonder, where have they been all this while? And then you find out that they've been going through all kind of treatment, from experimenting with malaria drugs, antibiotics, and the likes, from patronizing these notorious anti-nurse Adugbo people. It's really sad, and we need to stem the tide. Childhood cancers, for most of the cases, are treatable and some curable. The important thing is early detection. So you observe anything unusual going on in your child, please and please, let's stop this practice of self-medication. Let's present to the hospital promptly to ensure that we get the proper problems identified and treated. And again, I can't overemphasize getting health insurance. Trust me, you need it. You need it. I'll say it again. You need it for yourself, for your family, because no one plans to take ill, but you may never know when you will take ill, and it will help you and save you a lot of money. Till next time, Kunle Olofofo is right by the corner. Please like, share, subscribe, and keep following. Another series will hit the screen shortly. See you later.